Welcome back, high energy thinkers, to another episode of Mind Union. This is the show where we crush leftist ideology with facts and common sense. I'm your host, Dan Shyti. Early on, I made a commitment here at Mind Union that I would be discussing some of the most difficult issues that face our nation, and indeed, we have many. And it's my goal to bring you solid information that's thoroughly researched, so that people can become educated, informed, and make the best possible decisions for their lives, including voting the right way to benefit our country. Everything I say on this show has been thoroughly researched, and as I said, I have a deep commitment to live in truth. So if I'm ever proven wrong, it doesn't matter to me. I will rejoice. I will celebrate because I will have gained new knowledge. And new knowledge can only be discovered when we have contrasting and dissenting opinions. Unfortunately, the left likes to shut down debate, and that inhibits the dissemination of new knowledge. But we're undaunted here at Mind Union, so we are relentless in diving into the thorny issues, I like to call them, and bringing you the best possible information that I can. And one such thorny issue that is plaguing the country and escalating and getting out of control like a wildfire is the tsunami of transgenderism that is driven by underlying psychological condition known as gender dysphoria. The treatment protocols that are being widely accepted by some of the most reputable institutions in the nations, to my dismay, are actually harming our children. They are not resolving the underlying issues and are often leaving those poor children mutilated for life. So I decided to bring on a pair of experts to discuss what they know. These are people that have deep credibility and experience in this field. Okay, with us here in studio today, we have two esteemed doctors. First, Dr. Quentin Van Meter. He earned his medical degree in 1973 from the Medical College of Virginia, good old MCV, right here in my home state of Virginia. He completed his pediatric endocrinology fellowship in 1980 at Johns Hopkins, and he served 20 years in the Navy Medical Corps, fellow service member. I was Army. Okay. Don't hold it against me.
Okay.
He then developed his own full-time endocrine practice to serve pediatric patients, particularly those with endocrine disorders. Dr. Van Meter has been campaigning around the world to educate healthcare professionals about the harm of the affirmation of gender incongruencies and the associated protocols with that. And he's currently the president of the American College of Pediatricians. Also with us, Dr. Andre Van Mol. He's a practicing doctor with family medicine specialist in Redding, California. He has over 37 years of experience in the medical field, and he graduated from the Medical College of Wisconsin in 1986. And he's affiliated currently with Mercy Medical Center of Redding and Shasta Regional Medical Center. And he also serves or shares Dr. Van Meter's concerns over affirmation of gender incongruencies. Gentlemen, did I miss any bona fides that you'd like to share with us?
No, good. Well, I'm actually the immediate past president of the American College of Pediatricians. My term came to an end on 1 January, so I served in that role for about 3.5 years. So that's a correction to make.
Okay, good. Who is the current president, by the way?
Mike Artigues. He's a pediatrician in Jackson, Mississippi.
Okay, all right, terrific. Now, you were on the board, or at least an adjunct professor at a couple of universities recently. What happened there?
Well, when I arrived in Atlanta after I retired from the Navy in 1991, I established clinical faculty positions. It's a volunteer position, not financially compensated, so that I could teach the students, residents, and fellows that would choose to come to my office for clinical experience. And so that is an open door for them to come and have a look at pediatric endocrinology from a different perspective than the academic place where they train. And I maintained that all the way through these 32 years we've been in Atlanta until I was notified by Emory University that my term as a clinical adjunct associate professor had come to an end, and that I would not be invited to return to the faculty. And I sort of assumed it was a political move. It wasn't based on anything else that they would. And I asked specifically why that had happened, and I received no answer.
Okay, so let's dive into some questions. I have been looking into the gender dysphoria situation for quite some time, as I wrote a book called American Gaslighting, and that's when I first became aware of the American College of Pediatrics, or ACPed as it is known. And you've been, ACPed has been an opponent of the current gender affirmation protocol at least since 2018, if not before. Is that correct?
That's correct. I think the first position paper that was put together was put on our website in 2018.
Yeah, and that's the one I picked up, called Gender Dysphoria in Children, published under the byline of the American College of Pediatricians. And in the paper, ACPeds affirmed that 80 to 95% of children with gender dysphoria, also known as GD, wound up accepting their biological sex by late adolescence. And is that statistic still holding true today in what you're seeing?
It is, Andrea. You can speak to that with the most recent data.
Yeah, we have decades of data showing, conservatively, 85% of kids with gender dysphoria, gender incongruence, will become comfortable with their biological sex by adulthood. And that keeps repeating itself with research data coming out of the major centers across Europe as well.
Now, are these children doing nothing, or are they simply applying counseling and psychological support?
That's if you do nothing. If you add proper psychological support, you would, of course, improve the stats.
Wow, impressive. Okay. Now, my research assistant and I have been working diligently to put together segments on gender dysphoria, because it's such a pressing issue in our society today. And that's when we came across, it's in January, but your news release where you called for organizations to immediately scrap current transgender protocols. And this was based on a paper, right, that prompted that urgent call. Can you give us an overview of the findings of the paper that prompted you to make that news release?
The paper essentially was about what's called the Dutch protocol. This was a treatment plan devised by a committee over in the Netherlands, members of WPATH for the most part, WPATH being the World Professional Association of Transgender Health, which is an ideology organization, a purely non-scientific organization. It's not professional. It requires no training or certification to become a member. All you have to do is pay dues. That organization sort of infiltrated the care in Europe, and the Netherlands was the center where children were sent to try on for size an intervention with first counseling of some sort for a period of time, at least 6 months, and then blocking puberty from happening in these children, and then introducing the sex hormones of the opposite sex to create a physical appearance of the opposite sex. And they've followed those kids serially over years and found that the truth, that although they were reporting benefit and in all cases improvement in mental health, this study, the paper you spoke of, unearthed the actual data, which showed there was absolutely no improvement in mental health, and the worsening of mental health that they said that happened in children who did not complete or go through this protocol had to do with a patient population, 80% of which had disappeared from accountability. So it was really a very false house of cards on which to build the basis of therapy for the world, if you will, of transgender health. And Andre, anything I missed there?
Oh, no, those are the main points. I mean, the point is there's nothing here that's based on comprehensive literature reviews. There's nothing here that's how we normally, do high quality studies where you've got a control group and that kind of thing. And we have research that's come out of Northern Europe now. I can think off the top of my head of 5.5 comprehensive literature reviews of the subject that have been done, 2.5 in the UK, 1 in Sweden, 1 in Finland, and 1 done by the state of Florida. In the case of the Northern European countries, it resulted in a complete reversal of what they were doing. And these were lead engine nations in driving forward this whole gender transition procedure way of handling what is essentially a mental health problem. And again, they have reversed themselves. What they have reversed themselves to is a strong emphasis, a priority on mental health evaluation and treatment for both the gender dysphoric youth and their families. And the reason is self-evident, that we have decades of literature showing the overwhelming probability in gender dysphoric kids of underlying mental health problems, adverse childhood experiences, an unusually high percentage of autism spectrum disorder, and I'm sorry, I'm leaving out one. I shouldn't have done that. But mental health problems, neurodevelopmental
ADHD?
problems. Yeah, that's the ADHD thing. Excuse me, ADHD would be part of the mental health problems.
Right.
And we're talking very high rates there, So if you got a kid that's depressed or anxious or, has a personality disorder, bad family situation, the answer to that is to address the mental health problems. It's not chemical sterilization and surgical mutilation. And that's the conclusion that these countries have come to. And again, when we're speaking of the UK, Sweden, Finland, and as of a couple of weeks ago, Norway joined in with that. No one can call these politically conservative countries, or that, this is religious people, doing the state church violation thing.
Right.
And I know that sounds kind of off target perhaps to some of your listeners, but that's the kind of baloney we have thrown at us all the time when we bring up the science on this thing. And
right.
The fact is the science is there. It hasn't been paid attention to, certainly in the United States. But here's Northern European nations doing the right thing and deciding that these gender dysphoric kids need protection and mental health help, not chemicals, not hormones, and certainly not surgery.
The Dutch protocol, if you will, is the foundation on which all guidelines for doing these gender transition procedures that are recommended, it's all based on the Dutch protocol. So the Dutch protocol is the foundation. WPATH was the first organization to come across with guidelines. They refer to them as standards of care, but standards of care are very specific documents that involve a conglomerate opinion of everybody in the field, left, right, middle, center, up, down, sideways, getting into a room together, battling out and coming out with something they can all agree with and sign on to. That's never been done in the field of transgender health. These are ideologues who say, this is what I believe. It may not be based on science, but man, do I believe it. And if you don't believe it, you're horrible, you're bigoted, and you're transphobic, and you're possibly a Christian, and you possibly live in the southeastern states of the United States, where lots of dumb people with bad ideas live. That essentially is the undercurrent sense of who they describe us as being. And so you base these guidelines from WPATH, and on top of that, other professional societies in the United States, most notably the Endocrine Society, the Pediatric Endocrine Society, the American Academy of Pediatrics, the American Medical Association, the American Association of Family Practice Physicians, the American Psychological Association, American Counselors Association. All of these organizations just rubber stamp this baloney from WPATH and call it standards of care. And then they say all professional societies, all the decent physicians, all mental health care providers support this as the standard of care, and not providing this is taking away essential medical services that are life-saving. And there is nothing farther from the truth.
Right. So just for the benefit of our listeners, the name of the paper, which I have here and I will post to my website, is called The Myth of Reliable Research in Pediatric Gender Medicine, a critical evaluation of the Dutch studies and research that has followed. And I read the whole thing, and as a non-medical person, it was a slow read, but I gleaned quite a lot, and I'm an engineer, and I do understand statistics, and the the extraordinarily loose statistical manipulation, okay, on which the whole Dutch protocol was based is absolutely shocking. And the fact that it was a tiny sample size of patients, basically, that were studied that ultimately stayed with the program has now been used to just revolutionize how we handle this very important phenomenon amongst our youth. So, and the authors, in my opinion, were extraordinarily kind to Dr. Anne-Lou de Vries, who her and her Dutch gender team devised the gender protocol. But it's really junk science. Wouldn't you agree?
When you read, when you read the interpretation of the data, and you then subsequently have a cadre of ideologues in the United States more recently who data mine from very extensive surveys of individuals. It's called convenience sampling. It has a very strong bias. If you've got organizations, too, in particular, the Transgender Health Survey and I'm blocking on the name of the other one, the Trevor Project. These are activist groups that send out surveys to individuals online, recruited them through their activities and their promotion of ideas. Said, if you would please take this survey, and they are recollection of things in the past. They are not data collected by professionals with a very careful eye on screening for undercurrent mental health issues, or even verification if anything that's in the survey is actually a real answer or a wishful thought instead. These surveys, 25,000 strong, are used, data mined by authors here in the U.S. to put together things that would support their theory that they want. And they're called science. They, as convenience sample studies, prove absolutely nothing. There's no causality that can be done. Previously in the medical literature, in respectable journals, editors would never accept these articles to say that you can say that suicide is improved if they had access to puberty blockers in childhood, and it was worse if they didn't have access. And yet,
Andre, did you want to add to that?
Yeah, and the game that's being played with these studies is, in the limitations section, they will say, well, retrospective data can't be used to make statistical projections. And then they go ahead and do it, and they get away with it. Even the title of the paper, and it makes it right past the editors. So it's creating a really bad body of data that then becomes this self-referential thing that everybody, quotes. But yeah, it's really low quality science. And that is what these comprehensive literature reviews out of the UK, Sweden, Norway, and the last thing should have been Finland and not Norway, as well as Florida, is they consistently find that whatever you're looking for, amongst their claims of help from gender transition procedures, that the support for it is low to very low quality data. And by definition, that means what is being claimed is not shown by the data that's being presented. And again, that's what led those countries to do the 180 on it. The state of Florida has done a 180 on it, and the science supports it. But the ideologues are, of course, in lockstep and have captured the academic institutions, corporate America, a lot of the major medical organizations. But keep in mind, the medical organizations don't speak for the rank and file. I mean, this is, a small number of people on top that come up with the policies. And, no kidding, the doctors find out about it when the newspapers tell them it's the policy now. It's not like they've ever had a vote on what's going on. But as I, and no doubt Quentin, have presented to state legislatures when we're talking to them, is the reason you don't have more doctors like us up here is there is the very, founded fear of loss of your job, loss of your career, loss of your personal safety, and potentially that of your family as well. That doesn't seem to move them too much from what I can tell. But the evidence is increasingly solidly against doing these interventions on kids. What they need is mental health support for the underlying problems.
Just for an example, I testified last week in Texas at the State House hearing on Health about a bill that was being proposed to ban these procedures, social interventions, medical and surgical interventions in the state of Texas. And subsequent to that hearing, my private practice office was bombarded with calls from individuals screaming obscenities. I got emails that were also for the obscenities and foul language and threats. And someone has tried to break into some of my internet-based accounts, and I know that because I'll get the signal, "Hey, please enter your code," because it requires a secondary verification of ID. So people are literally trying to get into and harm me as much as they possibly can, just because I stood up and made statements.
Yeah, it's absolutely crazy. To continue with the thread on the credibility of this supposed foundational research, are you familiar with the name John Money?
Yes.
Yeah. I actually trained under him when I was a fellow at Johns Hopkins. He was on the clinical faculty. He was notorious and I will just plainly say it's not good to call people names, but he was a perverted individual with perverse kinds of ideas of how to deal with patients. He was at Hopkins primarily as a clinical psychologist on the psychiatry department faculty, on loan to the endocrine division, if you will, and he created a team of individuals who would come and interview patients who were and families that were dealing with children born with ambiguous genitalia, kids with precocious puberty, kids with tumors that produced hormones that would, in the case of a child with a liver tumor that was producing testosterone, and sent this child into the appearance of puberty, although it was not true puberty. He would interview these individuals and their families and make suggestions. He decided for the family what the child's gender of rearing should be, despite their incongruent biologic sex. The outcomes were, for the most part, dismal and sometimes fatal. Because of that, his program was shut down by Johns Hopkins. But he would teach us some of the most bizarre things that he would think up. And his concept was, I have an idea. Let's do this to children and watch what happens. I mean, very frankly, that's as scientific as it was. There was no informed consent. There was no, no accounting for the benefit and measuring it. It was, let's just do it and see what happens. And that was shut down and forever until recently, put in the dark dungeons of the archives of Johns Hopkins. And now there is a reawakening with Johns Hopkins has its own transgender clinic, and in their children's hospital magazine lauded John Money once again as a hero. So it's what goes around comes around.
Yeah, unbelievable. Now, there's also, we were talking about the European nations that have reversed course, and there's the infamous shutdown of the Tavistock Clinic in England. What's your familiarity with that case? We'll start with Andre and then go back to Quentin. What caused that? Because there are also now thousands of lawsuits pending.
Yeah, Tavistock was the world's largest pediatric gender clinic. So the Brits consolidated everything into one. And there was a series of things that happened. The Bell versus Tavistock case, which was won in what's called the British High Court, which it's different than what we think of as High Court here. It's been appealed, but litigation on that continues. The first comprehensive literature review was from their National Institute of Healthcare Excellence, which goes by the acronym NICE. And NICE 1 was on puberty blockers, comprehensive lit review of that. And NICE 2 was on cross-sex hormones. And they found very low quality data. The stuff didn't hold up. And what ended up happening is Dr. Cass, who is, I think, past president of the Royal College of Pediatricians or whatever they called it, she was asked to head it. And it's still underway, and that's called the Cass Review. But their interim report was released last year, and just what it contained led to the closing down of Tavistock. They plan to reopen it this year under a completely different model, strong emphasis on mental health. Now the teams are going to have developmental specialists, experts on autism spectrum disorder, the kind of thing you'd expect with what I was alluding to earlier. So that's pretty much what happened there, and the world's largest pediatric gender clinic closed.
And a wonderful statistic emerged from Tavistock. Okay, there were long waiting lines. I mean, the periods of waiting for patients to be able to get in the doors to the Tavistock clinic. So every patient in Britain who's in the National Health Service is followed. The good, bad, and the ugly data come out. And what they found is the incidence of completed suicides. Now, mind you, suicide is the battering ram that is used to push forward the need for these interventions, so-called, or procedures. Because without these procedures, we are told these children kill themselves. And what we're doing by allowing them to get through these procedures is to improve their mental health and save their lives. Mm-hmm. So the data that came out of this thing, Tavistock, is that the 0.03% of children who were in waiting and not having any medical or social intervention or surgical intervention, 0.03% of these children committed suicide. Wow. Compared to the number of children that were in the program and either partway through or well into it, and that number was 0.03%. So the lie that the interventions are successful in saving lives and stopping suicide is absolute trash, utter garbage, and should not be uttered again or believed. And yet it is the main threat that is used in the United States, and it should be unplugged and put to bed for good. But that's what we know, and that is a tiny number of it. I mean, every suicide is a tragedy, but all of these kids are suffering from, well, most of these kids, and I would just venture in my own clinical experience, every single one of them has undercurrent emotional issues, and one does not really take one's life unless one is severely depressed or anxious. And so if you don't take care of the problem, you're going to have kids taking their lives.
It's not just that they can't back up their claim that gender transition procedures reduce suicide. It's that the best studies show the worst results. 2011 study out of Sweden, a comprehensive study looking at all transitioners over 30 years. So they followed 324 people. They found that if you actually follow them 10 years out, not the usual 6-month, 1-year, 2-year honeymoon period, but if you follow them 10 years out, they had a completed suicide rate 19 times higher than the general population, almost 3 times the rate of psychiatric hospitalization. That doesn't sound like an improvement. 2019 and 20, the Brandstrom and Pachenka study, comprehensive review of the electronic medical records, 9.7 million Swedes. And they ultimately found that neither gender-affirming hormones, as they call them, nor what they call gender-affirming surgery improved any of the mental health benchmarks they looked at. Again, the best studies are showing the worst results on this stuff. Oh, one more thing.
Then go ahead.
The CDC 30 years ago, in their presentation on how to reduce the suicide contagion, warned that there is no one cause for suicide, and they cautioned everybody not to oversimplify presentations of suicide, and that the usual problem was complex underlying mental health problems. And we see that principle violated by the media all the time. And of course, when what you're advertising is suicide or a claim of it, for a problem that other people have, it has a contagion effect. That's called, formally, it's called the Werther effect, the suicidality of contagion reporting, which is why we're trying to knock that down. But there's an equal and opposite effect called the Papageno effect. When you're presenting something of somebody who was suicidal, but they find a way to power on and live life anyway, that also is contagious because it gives people hope that, oh, I don't have to kill myself. Maybe there's another way.
So in the Tavistock case, it's fascinating that the suicide rates were identical, right? Between, the ones that were being cared for and the ones that did nothing it was still 0.003%. Did I understand that correctly?
Yeah, 0.03.
0.03%.
Yeah.
Got it. So in essence, the ones who benefited from medical system inefficiency in England because they they didn't have any treatment, didn't go through any of the problems, the puberty blockers, or et cetera, because they couldn't get in the door, and they still survived and probably began to accept their biological sex. We've covered some very interesting ground, and we need to really tell people about what the long-term impacts are of these protocols, because they are indeed devastating. And the youth that go through these procedures early on are facing a lifetime of medical problems. Is that correct, right? And that's from puberty blockers, cross-sex hormones, and then ultimately the radical body alterations. So tell us about that, or what these youth are facing, so parents can understand the long-term consequences.
Well, sorry, Quentin, I'm going to let you do the heavy hitting on this, but the first step of it's actually social transitioning, and anybody can do that in a day. Change your name,
right,
change your dress and your makeup, and social transitioning alone is associated with derailing natural desistance in favor of persistence. It's not a benign thing, and the new protocols they're going to use in the UK emphasize that point. Social transitioning is not a benign step. Likewise, out of other Northern European countries, likewise out of France in a statement of their National Academy of Medicine. But when puberty blockers kick in, which the sales pitch on those is to call them a pause button, a wait and see, and that's not true. They are a gateway drug. They all but guarantee persistence. And the stats on that from the 5 major studies that looked at it were 96.5 to 100% persistence in those that are put on puberty blockers. And why wouldn't it be? Because every authority figure in this kid's life is, confirming the delusion. But I'll let Quentin pick it up from there in terms of the big side effects.
So, puberty is not a disease, okay? All of us adults, the vast majority, have gone.
We've all survived it.
Some are still in puberty in terms of their emotional status. It is turmoil. It's a time of a lot of upheaval in social and physical things, and its purpose is very simply to turn a non-reproductive individual into a reproductive individual once that process is gone. The advent of severe acne is a plague on adolescents that so many have suffered from, but we don't block puberty so that they don't have to go through that acne. We say we're going to do everything else we can to ameliorate the symptoms you've got, but certainly blocking puberty is not one of them that makes any sense, because you have to go through it in order to get to the other side of the fence. So not getting to the other side of the fence is not benign. In the case of bone density, there's a critical time in the life of adolescents from as puberty starts all the way up through age 25, and particularly in females where there might be a blockade in that. The calcium that's taken in the diet does not get banked into the skeleton. And if you have a calcium depleted skeleton as an adult and you reach menopause, you have hip fractures and other fractures that basically create a lot of morbidity. The ideologues on the other side absolutely saying that these puberty blockers are totally reversal, with a caveat that, well, maybe bone density is not something that can be regained, but that's just about it. And hey, it's overrated, and that's the only thing these folks have to stand on. In truth, what we don't know is what happens to brain development, heart development, other organ systems that require puberty to build the adult, to build a functioning adult that works as an adult, that can reproduce, that can lift heavy objects, that can care for children. All of those things that the brain and other organs do. Absolutely no one has done a study that said, let's interrupt puberty completely, hold it off, and see what happens 10 years, 20 years, 30 years, 40 years later. Is there early dementia? Is the brain going to not function the way it's supposed to because puberty didn't happen? And the answer is it hasn't been done, but there is a belief that, well, it's not important because the most important thing is to save the lives of these children so they won't kill themselves, will bypass that kind of a concept of careful study and looking for side effects. So puberty has a purpose. And so we cannot say the gonads alone. I mean, I dropped them off of the screen, but the ovary and the testicle need puberty to mature and create fertility as an adult. No one has any data on what happens if you never allow the gonad to mature, and you basically then fry it with the opposite sex hormones at high levels. And then ultimately, of course, you do sterilize the child permanently by removing the testicles and the ovaries and the reproductive equipment.
Right.
And so all of those things, as I say, if you design a clinical research study, and those of us who do clinical research are retrained every couple of years in the general clinical practices of following protocols and getting complete informed consent and designing studies and having them monitored by independent review boards for safety and efficacy. No protocol would be developed or approved by an institutional review board that says we're going to sterilize your child, and when their ovaries are fully functional, and when that's just an adverse side effect for something that is not proven to be of any benefit in the first place. Unlike chemotherapies in children that may damage the reproductive organs permanently, that saves the life of the child, because without chemotherapy, they do die.
Mm-hmm.
But in the case of the transgender individual, taking the gonads out makes them sterile, but they don't get any better from their gender dysphoria. So there is no reason to put together a protocol that would allow that to happen. Such studies, therefore, with ethical review, would never begin in the first place. I mean, it's just so illogic and so unethical.
Yeah, I mean, on its face, it is ludicrous. Okay, but also on top of that, you have lifelong dependency on hormone injections, right, for these children, dramatically increased risk of heart disease, thrombotic events, stroke, etc. Right? So they open up a really broad array of risk to their health, right? In addition to the obvious damage to their sexuality.
Yeah, that's right.
Well,
like you said, go
ahead, Andre.
I was going to say, increased risk of cancer of multiple types, heart disease, strokes, blood clots, on and on. And in the case of estrogen in a biologic male, that risk increases with every year you're on it. And it's not, oh yeah, of course it increases. It's an exponential. And the fact is, if mental health support were nothing more than breaking even with these gender transition procedures, it's superior because it leaves the body intact. It leaves your fertility intact. You're still all there. There's just nothing. And for all the studies that do look at it and they're, half-hearted, poorly done studies, there's just nothing that shows the superiority of hormones and surgery over the mental health approach. So what's the purpose of chemically sterilizing and surgically mutilating able-bodied young people for what is essentially a mental health problem?
And if you look at, these are things that, again, an adolescent cannot wrap their head around when they are 13 or 14.
Right.
You tell them you will have no functional sexual organs. Okay. Yes, they can take off they can sew your vagina shut, and they can attach a costume piece of some flabby skin that is exquisitely crafted by a plastic surgeon to look like a penis, with a scrotum beneath it, with artificial testicles placed inside to weigh the scrotum down and look from across the room as if it's a normal penis. It has no function. You might be lucky enough to pee through it, but it cannot become erect. It has no secretions that lubricate. It has no orgasmic capability whatsoever, or very limited, that you essentially are taking what would have been a sexually satisfied adult female, and you're basically taking their sexual function away. The kids believe they're going to become a male. I mean, in their heart of hearts, when I talk to my patients, that they're girls, they think they are going to become a functional sexual male. And the answer is they will become functionless. And the reverse is true in the males who have their penises cut off. and they bore a hole into the perineum and line it with maybe penile skin if they're lucky, or maybe some gut wall material, which has no lubricatory function, no ability to secrete function, no orgasmic capability, is really a useless tunnel which has to be dilated in order to keep it open. And that's not sexual satisfaction. And no 15-year-old, well, maybe some 15-year-olds who are sexually active could tell you what it feels like to have intercourse and experience an orgasm. But the majority of these kids are not necessarily sexually active and are naive in that regard. And they're giving up something they have no idea. Girls not being able to breastfeed when they finally come to their senses because their breasts are gone. The bonding of the baby and the mom at the breast is so physiologically well designed and so rewarding. And that is a no-go when you have no breasts.
Yeah, that's absolutely crazy. I want to go back to the social contagion aspect here. And I don't know if you'll be able to see the graph completely, but I'm going to show you a very interesting graph that we found in our research. And if it's cut off, I'll tell you that there's an inflection point at 2020 where you have kind of a steady rise of diagnoses, initiating a medical transition, and then initiating hormone therapy. And then the blue line basically shows a massive inflection, at 2020 that's coincidentally corresponds with the pandemic. And, there's got to be a social contagion component here, because around that time, a couple of things happened. Children were home from school. They were spending inordinate amounts of time online. TikTok was exploding during that time period. So do you see a connection, beyond what I just showed you, that's attributable to social contagion?
Okay. Social contagion. It's for, that element of it is as you describe, kids shuttered in the home because you can't go to school. And American schools are a big source of contagion right there, especially depending what the curriculum is there. Dr. Lisa Lippman, in her, first of its kind survey of parents of kids with rapid onset gender dysphoria, and these parents tended toward the left, but they noted in their kids, besides the underlying mental health problems that we'd referred to earlier, that really transgenderism becomes the catch-all diagnosis for any kind of mental stress or emotional difficulties the kid is facing, and transition becomes the cure-all solution. And of course, it's clearly not. And the web is very good at communicating, that false narrative. And again, it's all over the entertainment industry, education, and with smartphones and stuff, it comes straight at the kids. It's planted all over the place. And just having a friend, in a friendship group who comes out as trans increases the odds 3.5 times that other kids in that group will also so identify. You look up the prevalence rates of this and the DSM-5, of the American Psychiatric Association, and it says prevalence in natal females of gender dysphoria is maximally 3/1000ths of 1%. And in natal males, it's maximally 15/1000ths of 1%. So infinitesimal. But we see things like cheerleading squads in high schools where, 3 of the girls will come out as trans. Well, that's statistically impossible. So how is that happening if it's not social contagion?
Right.
Well,
exactly.
The ideologues empirically state in every one of their affidavits and their presentations that there is no influence of social contagion, that's a pure myth, and it has nothing to do with that. And my answer to that is it's and they say the reason that there is such a drastic increase in the number of transgendered individuals coming forward is because it's now the stigma is being removed by the compassionate people that are being educated in schools to accept this, and that makes all the difference. Well, that acceptance within the school system and the counseling offices is real. There's no question about that. But it doesn't account for the fact that in one Pittsburgh school district, 20% of the kids claimed to be, disgendered, if you will. So my story is, I use my gray hair and balding hair to say I've been around a while. And I was doing pediatrics back in the 70s and 80s and 90s. And in my general pediatric practice at the time, I didn't have a suicide rate of 41% of the kids, because, of course, nobody was transitioned back in those days, and no children were transitioned at all that we knew of. Well, if the outcome is suicide, for sure, if you don't intervene with these procedures, where were all the suicide deaths? And how come we didn't see them? And the answer is just because they weren't there, because the condition wasn't there. This is a manufactured problem. Not to say that gender dysphoria is fake, not to say that it doesn't exist. It's just programmed to be increased in numbers so that things can happen to these children that are advantageous to others.
Right. So the W path, they recently put out the SOC8 protocol, and you've already blown a hole in it that, it has no, scientific validity, and it's still relying on the Dutch protocol. But, is this a function of willful ignorance, corruption, or stupidity on the part of these people? What is it? How come they're so, they got their heads buried in the sand and won't entertain anything?
People can be very smart and still very wrong.
Right.
We don't have to go into ad hominems about it, but in an article, a first of its kind review article in the British Journal of Medicine in 2021 by Dellon, I think was the lead author, was the first to look at these different guidelines out there in the world and what we'll call their strength of evidence. And the WPATH SOC8, again, Standards of Care 8, and just because they call it Standard of Care doesn't make it one, but they were looking at the SOC7. Right. And they said the strength of evidence on the factors they looked for was 0/6. 0/6. That's ridiculous. There's no comprehensive literature review behind it. They just get more and more aggressive in their claims. And SOC8 eliminated age restrictions for everything, for puberty blockers, cross-sex hormones, and surgery. Well, that's simply unjustified.
Yeah. Yeah, there's just no way that any child that age can give informed consent to this kind of tragic treatment.
Yeah, and the Bell versus Tavistock case made note of that. It said there is no age-appropriate way to communicate to most children what it means to lose your fertility and your sexual function. And the simple way to explain that to people is get a group of 15-year-olds together and ask them, how many of you guys want to be married? And how many kids you want to have? Well, ask the same group when they're 21, ask them when they're 25, ask them when they're 30. The answers change. Right. The kid has no ability to project. They don't get long-term consequences. That prefrontal cortex, the brain's inhibition center is not fully developed for a quarter century. Kids are given to impulsive behavior. They're given to risk-taking, and they're certainly affected by social and peer influences. We protect them from everything else while they're minors. And in the case of alcohol, because of a track record, we protect them until they're 21. So the idea that a kid's going to, be able to say the biologically impossible, that I'm born in the wrong body at an age where they can't really determine what their dinner should be or what their bedtime should be is ridiculous.
Yeah. Yeah. And we have, I'll use the word, nutty parents as well. Some of them that claim their 3-year-old, just let them know that they want to be a boy or they want to be a girl, and the parents, have bought into the ideology, and it's almost like it's fashionable to then have a child that's going into. Yeah. So, there's that aspect of the contagion as well. And the contagion, it appears to have infected the medical establishment, because so many otherwise reputable organizations, have bought into this. Now, to wrap up with somewhat of a positive note, what's the the light at the end of the tunnel? So let's say, you're a parent of a child that comes to you and says, I want to be the opposite sex. What should you do? What's the best way to handle it? and also what resources are available to parents that are truly objective and aren't simply ideological fronts?
Well, I think you first of all establish your caring for that patient, and your empathy for what was going on, and you basically present yourself as I will be a solution, and I will facilitate a solution that is proven to be of benefit. I will do you no harm. I will not even start on a program that has any semblance of way more harm than good. I will educate you with literature and that's designed for parents. It's very hard to get the kids to read this stuff. They refuse to read it. It's not if it's against their opinion, they will not look at it. But you bolster the parents, and then you find counselors in your community where you practice who are very willing to just look at the depression and the anxiety. Don't focus on the transgender. Put the transgender aside. Get the mental health. Open the doors. Air out the dirty basement and the laundry that's there. It's sometimes you're going to get resistance from parents because the parents are actually part of the trauma that set them up. So you have to be very artful at what you do. But the mental health, you provide those resources. You go to your community mental health people and say, are you willing to do this? Are you willing to, and don't be afraid. Don't send them to the transgender clinic psychology experts, because that's a place that's one way rapidly.
Right.
Do the job that needs to be done. That will give them the resources. And so the American College of Pediatricians, to which we belong, is actively putting together a resource for parents. And it will be something that will be up and running where they can go to a separate website that's not necessarily labeled American College of Pediatricians, but it will be used to be a resource to say, these are the things that do happen. These are the stories of the deep transitioners. This is how you, as a parent, can sort of retool and guide your child who is going to fight tooth and nail to go the direction that they want to.
Mm-hmm. Now, I want to ask Andre a specific question here, because California has been at the forefront here with the liberal ideology of passing laws that seem to be directed towards physicians to inhibit them from steering children away from transgender treatments. And so are there any laws? I know there's a lawsuit. I tried to find it. I didn't locate it in time for this interview, but there's a lawsuit now that might be heading to the Supreme Court that is a violation of the right to free speech, basically, and directly stands between a doctor-patient relationship, preventing doctors from honestly telling a patient what they think. So to Quentin's point right now, what he made about establishing that do no harm bond with your patient, this law may prevent you from telling the child or the parents that there are alternatives and that they shouldn't buy into this railroading of transgenderism.
Yeah, you summed it up. It's pretty much, it's more than one law, but I know the one you're thinking of in particular, trying to muzzle, doctors if they're going to say anything that the state disagrees with. And you're right. It's a flat out, and that's what I wrote in my testimony against it, is on its face, this is a flat out violation of the First Amendment of a type that has already lost. In the case of California, there's a previous case that was backhanded away by the Supreme Court, basically telling the state they need to refamiliarize themselves with the First Amendment. So there's 4 or 5 really bad laws that passed just in this past election cycle. Several of them have already been knocked down just by lower court decisions. I don't think any of them would survive a Supreme Court challenge, and that's where they need to go.
And also, just beyond the state of California, the Biden administration is very busy with Health and Human Services, passing regulations or beefing up or changing regulations that indicate that any physician that denies medical interventions or surgical interventions or social interventions must be fined, or if they are providing care within the government's healthcare systems, and essentially for kids, that's Medicaid. So it's illegal, and if we persist in what we're doing, we can be fined first, jailed second. Our practice is shuttered by the federal government. And that's being fought. And that will also never make it past the Supreme Court.
The transgender mandate that started with the Obama administration got shot down twice during the Biden administration as they tried to push it forward even more. And it lost at the Fifth Circuit level and the Eighth Circuit level. So that one's dead in the water. So what the Biden administration is trying to do now with this just has no chance in high court.
Yeah, but it doesn't stop them from persisting. And, just on other issues, the Supreme Court rules, and then they come right back with new variations of these so-called laws. So they are relentless. And gentlemen, on that note, thank you so much for your time. I really appreciate you appearing on Mind Union, and I wish you the very, very best in your endeavors here to fight this insane contagion. And I hope that you're successful.
Thank you.
Well, we appreciate your opportunity in asking us to be here today, and your efforts that are going to continue, I hope, in this very same direction. You have us on your team for sure.
Yeah, absolutely. Okay. Thank you very much.
Thank you.
Well, high energy thinkers, that does it for another episode of Mind Union. Be sure to like this video, subscribe to the YouTube channel, and visit mindunion.com. And until we meet again, put on the body armor of God, speak the truth boldly, and always think clearly.